If you're a teen athlete or a parent of one, you know how essential foot health is for performance. Unfortunately, common injuries like ankle sprains and plantar fasciitis can sideline even the most dedicated players. My name is Dr. Andrew Schneider, a podiatrist based in Houston with over 2 decades of experience. Understanding the risk factors and implementing preventative measures can make a significant difference in avoiding these setbacks. In today's video, we'll explore some actionable steps that can help keep you in the game and out of the doctor's office. But before I do, I wrote a book all about children's foot health. I'd like to send you a copy as a gift. Visit www.kidsfootbook.com to request your copy. Also, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. This will help others find the information they need. Foot injuries in teen athletes often go unnoticed until they lead to more severe complications. This oversight can result in chronic pain, long-term disability, and even early retirement from sports. Recognizing the signs of foot injuries is important for maintaining an athlete's performance and overall well-being. You should pay attention to symptoms like persistent pain, swelling, or difficulty in bearing weight. These can indicate underlying issues that may worsen without proper intervention. Prevention is equally important. Implementing appropriate footwear, warm-up routines, and conditioning programs can significantly reduce the risk of injuries. Education plays a crucial role in prevention. Coaches, parents, and athletes must be informed about the types of injuries that commonly occur in young athletes. By fostering an environment where an athlete feels comfortable reporting pain or discomfort, you can prevent minor injuries from escalating into serious conditions. Ankle sprains are one of the most common sports-related injuries among teens, often resulting from the sudden twists or impacts during physical activities. When you sprain your ankle, the ligaments that support it stretch or tear, leading to pain, swelling, and difficulty bearing weight. You might notice bruising and limited range of motion as well. There are 3 grades of ankle sprains. A grade 1 sprain involves mild stretching of the ligaments, while a grade 2 sprain includes partial tearing, resulting in moderate pain and instability. A grade 3 sprain is a complete tear, causing severe pain and significant joint instability. To prevent ankle sprains, you should always wear appropriate footwear with good support and traction. Warming up before activities, practicing proper techniques, and strengthening the muscles around your ankle can also help. Additionally, consider using ankle braces during high-risk sports, especially if you previously injured your ankle. Pay attention to your body. If you feel discomfort, take a break to avoid further injury. Taking these precautions can minimize your risk of ankle sprains and keep you active and injury-free during sports. Stress fractures are often overlooked yet important injuries that can impact teens participating in sports. These tiny cracks in the bone typically result from repetitive force, often due to high-impact activities like running or jumping. You might not even notice that you're in at first, but it can gradually worsen, making it difficult to perform at your best. Commonly found in the foot, particularly in the metatarsals, stress fractures can lead to prolonged downtime if not addressed. Symptoms often include localized pain that intensifies during activity and eases with rest. If you experience persistent discomfort or swelling, you should come in so I can x-ray your foot for a proper diagnosis. To prevent stress fractures, you can take several proactive steps. Gradually increase the intensity and duration of your training, ensuring your body has the time to adapt. Incorporating rest days is essential, as it allows your bones to recover. Wearing appropriate footwear and maintaining a balanced diet rich in calcium and vitamin D can also support bone health. If you've had a stress fracture, wearing a custom orthotic will help to reduce the pressure on the bone and allow you to resume full activity. Another common injury that many teens face in sports is plantar fasciitis. This condition occurs when the plantar fascia, a thick band of tissue connecting your heel to your toes, becomes inflamed. You might experience sharp heel pain, especially with your first steps in the morning or after prolonged periods of sitting. Several factors contribute to developing plantar fasciitis. High-impact sports like running, basketball, and soccer increase the strain on your feet, particularly if you're not wearing supportive footwear. Overtraining without proper rest can also lead to this injury, as can excessive weight or flat feet. To prevent plantar fasciitis, make sure you're wearing appropriate shoes that provide adequate arch support and cushioning. Stretch your calves and Achilles tendon regularly to maintain flexibility. Incorporating cross-training can help reduce the repetitive stress on your feet. If you start feeling heel pain, don't ignore it. Address the issues early to avoid worsening your condition. Consult your podiatrist for guidance on treatment options, which may include rest, ice, orthotics, and physical therapy. Taking these preventive measures can help keep you active and pain-free. In sports, you may encounter another common injury known as Achilles tendonitis, which involves the inflammation of the Achilles tendon, the band of tissue connecting your calf muscles to your heel. This condition often results from repetitive stress or overuse, especially in activities like running, basketball, and soccer. Symptoms typically include pain and stiffness along the tendon, particularly after activity or in the morning. You may also notice swelling and thickening of the tendon. If ignored, Achilles tendonitis can lead to more severe injuries, such as tendon tears. To prevent this injury, it's essential to incorporate proper warm-ups and stretches into your routine. Strengthening exercises targeting your calf muscles can also help to maintain tendon health. Gradually increase the intensities of your workouts to avoid sudden jumps in activity level. Wearing appropriate footwear that provides adequate support is vital as well. If you experience persistent pain, seek medical advice promptly. Early intervention can prevent further damage and aid a quicker return to your sport. Remember, listen to your body, and allowing adequate recovery time is key to preventing Achilles tendonitis. High-impact sports, characterized by their intense physical demands and the rapid movements they require, pose significant risk factors for foot injuries in teens. Activities such as basketball, soccer, and gymnastics involve sudden starts, stops, and directional changes, increasing the strain on your feet. These sports often lead to overuse injuries, where repetitive stress can cause damage to tendons, ligaments, and bones. The high forces exerted during jumping and landing can contribute to conditions like plantar fasciitis, stress fractures, and ankle sprains. Additionally, the competitive environment can lead to inadequate recovery time, further heightening the risk of injury. You may also face challenges with coordination and balance, which are essential for preventing falls or missteps that can result in injury. Your physical condition plays a pivotal role. If you're not adequately conditioned or lack strength in your lower extremities, you're more susceptible to injuries. Understanding these demands can help you recognize the significance of proper training, including strength and flexibility exercises, to prepare your feet for the stresses of high-impact sports. Proper shoes play an essential role in preventing sports-related foot injuries among teens. Inadequate footwear can greatly increase your risk of injuries, such as sprains, fractures, and plantar fasciitis. When shoes lack proper support, cushioning, or fit, they fail to absorb impact effectively and protect your feet. Worn-out shoes can lose their shock-absorbing capabilities, leading to discomfort and increased risk of injury. If your shoes are too tight, they can cause blisters or other painful conditions. On the other hand, shoes that are too loose may not provide adequate stability, making you more susceptible to ankle sprains. Additionally, choosing the wrong type of shoe for your specific sport can worsen these issues. For instance, running shoes may not offer the lateral support needed for basketball or soccer. Always consider the specific demands of your sport when selecting footwear. To minimize your risk, invest in high-quality shoes designed for your activity. Make sure they fit properly and replace them regularly to maintain their protective features. By prioritizing proper footwear, you can greatly reduce the likelihood of sports-related foot injuries and enhance your overall performance. Inadequate footwear isn't the only factor that can lead to sports-related foot injuries among teens. Overtraining and the lack of rest are critical risk factors that can greatly increase your chances of injury. When you push your body beyond its limits without allowing sufficient recovery, you disrupt the natural healing processes and increase stress on your muscles, tendons, and ligaments. Overtraining can manifest as fatigue, decreased performance, and a higher susceptibility to injuries such as stress fractures and tendonitis. Your body needs time to recover and adapt to the physical demands placed on it. Failing to incorporate rest days into your training schedule can lead to a cycle of chronic injuries that might sideline you for extended periods. To prevent these issues, listen to your body. If you're feeling persistent fatigue or discomfort, take a step back. Ensure you're including rest days into your routine and balancing your training intensity. Additionally, consider cross-training and build strength in different muscle groups without overloading your feet. By prioritizing rest and recovery, you can minimize your risk of injuries and maintain performance in your sport. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. Don't forget to order my free book about children's foot health. You can order your copy at www.kidsfootbook.com. The link to request the free book is in the description. If you or your active teen is experiencing foot pain or any type, don't wait. Contact the office. We'll get you in for an immediate appointment. The sooner we address the issue, the quicker we can get your athlete back on the playing field. The link to request an appointment is in the description. Thanks so much for watching, and have a great day.